of the New York State Nurses Association, representing over 42,000 nurses and caregivers throughout the state. I want to thank the press, our esteemed community and elected officials, and most of all, our dedicated nurses for coming out on this cold March morning. We're here today to announce a pending strike of over 10,000 nurses in the major medical centers of New York. And we're here today to prevent a strike. While we entered negotiations with our hospitals over 6 months ago, instead of bargaining in good faith, they've withheld information, engaged in repressive practices in the workplace, and attempted to silence our voices. We'll be silent no more. The crisis that we'll speak about has been percolating, has been escalating for years. The crisis is all about you, our community, our patients. Our hospitals are severely understaffed, unnecessarily, because nurses are simply taking care of too many patients. When research, standards, best practices, common sense, and our own professional knowledge and experience point to the number of patients that we know we can care for safely, with kindness, with compassion, with expertise. And year after year, protest after protest, these hospital administrators ignore us. What choice do we have? Nearly 9,000 nurses voted by a 97% plurality to authorize a strike in these facilities. Our principal demand? Safe staffing ratios, a safe workplace, community involvement in best addressing the needs of our patients. We have not been able to reach agreement on even one proposal. The hospitals categorically refuse to discuss safe staffing ratios. How can we care for you when we're forced to take on loads 2 times, 3 times, 4 times what's clearly understood to be safe, let alone quality care? We cannot. And while we abhor and oppose the draconian cuts in healthcare budgets proposed by our government, that's a tiny part of the problem. The problem is, how are our hospitals spending the money? They choose to pay millions for marketing, consultants, advertising, branding, and exorbitant executive salaries. Look at this graph. How many caregivers can we hire for $17 million, the salaries of our so-called not-for-profit execs? Hospital resources should go to the care of our patients, not to superfluous and irresponsible marketing strategies. The crisis in healthcare has become an epidemic. But unlike measles, unlike influenza and other diseases, there's a cure for this disease: safe staffing ratios for our patients. We implore you, our community, our elected leaders, our patients and families, to demand that these hospitals work with us to prevent a strike, to negotiate safe staffing so that you can not only thrive but survive a hospital admission. Safe staffing truly saves lives. Safe staffing saves lives. Safe staffing saves lives. Safe staffing saves lives. Thank you. I'd now like you to hear from some of our nurse leaders who are also practicing nurses. I'm going to introduce Corinne Raymond, the co-president of Montefiore Medical Center in the Bronx.
Technology. Good morning, everyone. My name's Corinne Raymond. As Judy said, I am one of the nurses at Montefiore Medical Center. I've been a nurse for 25 plus years, and I've seen a lot, and I've cared for many patients. It's been what I've been blessed to do, and I'm grateful for the privilege to have cared for so many patients. As nurses, as nurturers and professionals, we are forced to take a strike vote. We are prepared to use it because, quite frankly, enough is enough. We do not have enough nurses at the bedside, despite what hospital execs and nurse leaders at the hospitals will tell you. They don't have the capacity to flex up, as they may tell you. They rob Peter to pay Paul to try and make it work every day. Our patient population depends on our care. They are very complex patients, and they deserve to have a nurse at the bedside who's qualified and able to take care of their needs. The necessary improvements that the safe staffing ratios that we are asking for have been ignored for years. In 2014, I remember at our facility where patients were back to back and crammed into our emergency room at the Weiler campus, we launched a protest of assignment campaign that specifically outlined that we were 30 nurses short. We still have not filled those vacancies. Nurses leave in droves because of the working conditions. We struggle daily to maintain a safe working environment for our patients, family members, and for ourselves. We want and need to be able to take care of our patients safely. We want to minimize the number of protests of assignments we file on a daily basis. These are testimonials and documentation of the unsafe staffing situations that we are forced to work in. We file so many across our facilities, across the city, and yes, indeed, across the state. These protests of assignments have been evaluated into patient care chronicles, and we have them available to you should you desire to see them. Management will and have reported to you that they don't believe in ratios. This is absolutely not true. They use ratios every day. Ratios already exist. These nurse-to-patient ratios are old, outdated, and draconian. Can an emergency room nurse take care of 15 to 20 patients? These patients come to the emergency room at their worst state of health. Should a nurse in the emergency room be taking care of a patient suffering a heart attack while she has 6 other patients in similar situations? We say no. Should a medical surgical nurse have 6 patients, one of whom is on a machine to help them breathe and is receiving multiple medications that should be monitored minute by minute? How can she do that? How can he do that? We say it just shouldn't happen. There aren't enough nurses at the bedside. We know this to be true despite what hospital execs and hospital nurse leaders, who I might add haven't been at the bedside for a very long time, are telling you. We need to make the improvements that we are asking for. These improvements will allow a nurse to critically think about what her patient needs. We also need more beds. We need more room. Our patients are crammed into overcrowded emergency rooms across the city, not in just one facility, but in every facility. Our executives and our nurse leaders then decompress them and relegate them to the hallways of our units where nurses are already carrying far too many patients. Staffing isn't flexed up, as they may tell you. Patients should go to beds in rooms with bathrooms, with call bells, and oxygen. I recently heard a family member explaining while going down to get a cup of coffee. At least we got a bed in a room. I felt ashamed. Where I work at Montefiore Weiler, there's a hospital that Montefiore recently bought in 2013 and 14. It sits empty. There are about 60 empty beds where our patients could go to, instead of going to the hallways where they are cared for with the best of our ability. I've seen so many patients go to the hallway, and it's been heart-wrenching for me. If you're a VIP, you'll get a bed. They'll paint the room and they'll change the curtains, but our community goes to the hallways when the beds are no more. Safe staffing is not a new phenomenon. We have consistently brought our concerns to management in many different forums. And it remains a problem that we have to solve. And if we must strike, we have to strike to solve this problem. Thank you.
Give me a hug.
Okay. Sorry.
We have an elected official with us who is very busy, not that we're not all busy, but he is our favorite, our city controller, Mr. Scott Stringer, who's been a longtime supporter of nurses. I welcome Scott Stringer.
Good morning, everybody. I wanted to come by to let you know that the action that you take today, that you put it all on the line for the patients you take care of every day. I just wanted to tell you that I stand with you at this moment in time. But I also want to tell you why. And your leadership knows how I feel about the work you do. But you are on the front lines. And no one truly appreciates a nurse unless your grandparents, your parents, your best friend is in a very serious situation at a hospital. Suddenly, you can't wait to see the nurse. That nurse is everything to you. Your mother comes out of surgery. You don't see the doctor. It's the nurse bringing her back to life. It's the nurse who, when you walk out, you entrust the person you love most. It's you who do this work. And when there's not enough of you that are able to do this work, then the loved one you entrust to you is not getting the care that they need. You can only do so much. And that's what this fight is about. You're actually not here for yourselves. You're here for the mothers, the fathers, the grandparents, and the children whose lives you save every day. And that's why this is an important struggle. 10,000 strong, multiple hospitals. What did you talk about today? Safe staffing. Most people come when they need something and say, it's about me. It's about what I need. But that's not how you roll. But I do think it is also about what you need. You've got to take care of your families. You've been taking care of ours for so long. You have a right to be in safe conditions, not shunted aside in hallways, not treated like second and third class citizens. You're the ones who are on the front lines for all of us. I said this at a nurses' rally a few weeks ago. I just want to say it one more time in a calmer way. My 5-year-old woke up some weeks ago. I have a 5-year-old. I know it's complicated. I know. I have a 7-year-old too, but that's in church people say amen. Are you okay? But I know what you're thinking. But I want to tell you about little Miles, right? Because I'm still new at this parenting thing. He comes in to the bed with us, and he's heaving. He's heaving. He can't breathe. He's having trouble. And we call the doctor. The doctor says, come in and bring him in a couple hours. As I'm bringing him to the doctor, I realize that he really cannot breathe. And he's sitting there, and I don't know what that means. We immediately go to an emergency room. First hospital we see. But I know hospitals. As we're walking in, you also have to take out the insurance card, right? Because they want you to go to the desk, and little Miles is there, and he can't breathe. So I take the card out. I go to make them know that I have insurance, and I turn around, and Miles is gone. That nurse saw him, didn't ask for my insurance card, didn't ask my name, didn't want to know how I got there. I've now learned you have there's a certain procedure. You just took him and moved him in. I looked around, I couldn't even believe I didn't know where he was. But I found him with an oxygen mask on and a nurse hovering I mean hovering over that little boy, 5 years old. What would have happened if that nurse didn't understand what was happening? That nurse brought my kid to that situation. So I say to all of you today that we will stand with you, we will march with you, we will do it in the name of our families and our loved ones, and never back down because of the work you do. I so respect every one of you and your leadership and your president, and I thank you for giving me this opportunity to just say how much we in New York love you, because you love our families. Thank you very much.
We cry a lot. Just happens, comes with the profession. I want to introduce now Anthony Champa, the co-president of New York Presbyterian Hospital. Welcome, Anthony Champa.
Morning. My name is Anthony. Safe staffing saves lives. Staffing ratios saves lives. I'm saying this because we have a staffing crisis. Emergency rooms are overcrowded. Every inch of space is being utilized. Surges in patient population are not being properly accommodated with staffing. The somber reality is we have patients in hallways beyond our bed capacity because of staffing. Education resources are minimal because of staffing. Nurses are expected to take patients that we are not properly trained for because of staffing. Patients are living longer, and the acuity is much greater than it's ever been. Yet our staffing has not increased to meet these demands. We do everything that we do because we care and we love our patients. Nurses routinely miss breaks, our lunches, at an alarming rate, and we're even lucky if we're able to momentarily stop to use the bathroom. We forsake ourselves in the names of our patients. Management understands that a double patient load is not safe. Yet, for lunch, this is ignored, and we're forced to take on each other's patients' assignments, doubling our patient loads where we're already overburdened. When we are lucky enough to take our breaks, we spend it doing documentation, trying to catch up and keep our heads above water, instead of taking sorely needed rest periods. Unfortunately, our staffing is kept at a bare bones minimum, without increases to accommodate for staffing, acuity, skill mix. Management claims that our staffing ratios are rigid, but theirs are the ones that are rigid. And they do have ratios, and they do not staff above those ratios. Even if we have a sick call, one sick call should not capsize a unit, and it does. The short-sightedness of management lacks to prepare for nurses themselves getting sick, even as we take care of our own sick. Unfortunately, when we do call out sick, we often get blamed and publicly shamed to our colleagues that staffing is short today because Anthony called out sick and we don't have a replacement. Can you call your colleagues and see if someone can come in? Otherwise, this is how it's going to be. That is a stark reality, and it is poor planning. I just want to say and make it clear that we love our jobs. We love our hospital. And most of all, we love our patients. This is a cry for help. Nurses are getting shortchanged. New Yorkers are getting shortchanged. Our families, our patients, our loved ones are getting shortchanged. Together, with our community, we can do better, we should do better, because we all deserve better. Thank you. I'd like to introduce Mary Ellen Warden, co-president of Mount Sinai St. Luke's, Mount Sinai West, of our executive committee. Thank you.
Thank
Thanks, Anthony. I've worked at Mount Sinai West, formerly known as St. Luke's Roosevelt Hospital, for 36 years in labor and delivery. It's a very busy unit with a lot of patients and not enough nurses. Over the last 20 years, myself and my nurse colleagues have increasingly found ourselves taking care of our patients in circumstances that reflect serious understaffing. In situations of labor and birth and C-sections and newborns, minutes count. They count when a fetal monitor shows distress of a baby. They count when there is an emergency C-section. Minutes count when a woman can hemorrhage, and minutes count when a newborn needs to be resuscitated. As nurses, we can do our part in the best way, with the best outcomes, if we have safe staffing. We're often taking care of 2, even 3 patients in labor and delivery that have already progressed well into labor, when the best standards of care would have you only take care of 1 of those patients. I have felt that sinking feeling when I have to excuse myself from one patient to run to the next room to check my other patient, never able to meet the needs of both of those patients the way that I should. And minutes count. Patients deserve to have consistent, safe staffing. We want the hospital administrations to make the bold move to resolve this crisis. Come to the negotiating table and fix this problem. Thank you.
Thank you, Mary Ellen. I now want to introduce Robin Krinsky, the president of Mount Sinai Hospital. Robin.
Good morning. Nurses are pivotal in the provision of high-quality acute care in hospitals and organizations. The hospitals that we work for are the major acute care facilities serving the needs of the people in the city of New York, as well as the population of patients that come to us from all over the United States and internationally. Many of the services that we have at our hospitals are in the top percentage of programs in the United States. And because of that, we care for patients that other hospitals cannot care for due to the extensiveness of their diseases, the rarity of their diagnosis, and the unique treatments and experimental treatments we can offer them. In other words, we as nurses are caring for the sickest of the sick here in New York. On a daily basis, nurses are making hard choices on how to deliver excellent care to every patient and provide for their needs when there are not enough nurses available to do the job. When there are not enough personnel, care becomes chaotic, morbidity and mortality increase, infections, pressure ulcers, errors and miscare increase. And the people who suffer most from this are our patients, our community, our families, our nurses, and the hospital. The fact is, there's a staffing crisis in our hospitals, and our management is not appropriately addressing it. Patients have a higher level of acuity than ever before. So not only are we short-staffed, but people are sicker. Our hospitals are turning into intensive care units. My hospital is the intensive care hospital of the system. You have to be very ill, have multiple illnesses just to get a bed in the hospital or a bed in the hallway. Nurses in our emergency departments are caring for up to 18 patients at any given time. That is just not safe by anyone's standards. This trend has no end in sight. That is why we need safe staffing ratios. We need to ensure There are enough nurses on staff in our hospitals to deliver the highest level of care 24 hours a day, 7 days a week. And ratios are set by peer-reviewed studies for a reason. They are the standards for proper care for all patients. How our hospital staff now is just not working and has not been working for a very long time. But they keep doing it the same way over and over again. That's the definition of insanity. The results don't change, and that is why we need and must have ratios as they work, as shown by the ratios in California, where they are mandated by state law. It is now time to give all the patients the nursing care they need and they deserve. Hospitals cannot afford to do this. Not to do this. There is great potential for harm to patients because we don't have enough staff. Patients are in jeopardy. When I come into work, there are days that I am afraid I won't have the time to do what I need to do for my patients. It's not fair. It's not right. Hospitals need to respect nurses and respect patients. Patients need to be put before profits. Hospitals need to invest in their money in the product of the hospital, which is nursing care. The return on that investment will last a lifetime. The hospitals tell us that if we go on strike, we are abandoning our patients. This is absolute nonsense. As nurses, we have the legal right to strike, and we are not abandoning our patients. Our management has abandoned the patients a long, long time ago. They abandoned them when they didn't replace our sick calls. Yes, nurses do get sick too. When they didn't fill vacant positions. When they didn't increase staffing numbers in areas where they are severely needed. Now that is abandonment. And it needs to stop, and stop now for the safety of all New Yorkers. Thank you.
We have another esteemed elected official with us, the Honorable, well, we're all honorable, the Honorable Mark Levine, Councilman and Chair of the Health Committee of the New York City Council. I want you to welcome another supporter of patients, Mark Levine.
Thank you so much, Madam President. I am not nearly as honorable as all of you in this room who have chosen a profession that is arguably the hardest and most important in this society. And you didn't choose this profession because you want to get rich or because you want to have it easy. You chose this profession because you want to serve, because you want to impact lives, you want to save lives of the most vulnerable in the society. And I am full of admiration and gratitude for all of you. Can we give all the nurses here a huge, huge, huge round of applause? Thank you. You are amazing. You are absolutely amazing. You have asked for something that is undeniably fair and reasonable. You have asked for the resources to do your job well, the resources to adequately serve the patients in your care for the sake of their health outcomes and for the sake of health care and for the sake of this profession. You have asked for the physical space and facilities to do your job well, and you have most definitely asked for the staffing resources to do your job well. You have asked for safe staffing because this is a critical driver of patient outcomes. This is not about patients filling out a higher mark on their satisfaction survey. This is about the health outcomes of patients. Research has backed this up again and again and again and again over the years. This is about the health of those patients. And there are no shortcuts on this. At the end of the day, this is about funding. There's no way around it. This is about funding. And so it is deeply disturbing that amongst the long list of evils of the Trump administration, and we could do multiple press conferences just to go through that list, but amongst their most dastardly deeds is a tax bill that they rammed through that is going to cost this state billions of dollars. That's a huge problem, and we can talk about that, but we must make sure that we do not balance those losses on the backs of the most vulnerable in New York State. We cannot extract those cuts out of our health system. And we are on course right now to lose hundreds of millions of dollars out of our healthcare system. That is absolutely unacceptable. Those would mean devastating cuts in our vital public hospitals. How many of you are at public hospitals? Some of you are. Thank you very much. And it would mean devastating cuts out of our safety net hospitals. How many of you are at safety net hospitals? Many of you as well. And we are going to fight against this tooth and nail. It is not right to impose the burden of these cuts on the most vulnerable in the healthcare system. We should not be playing defense. We have been working now for months and years on offense to finally get staffing levels that our patients need and deserve, and we are not stepping back in that fight, and we are not going to allow these cuts to send us backwards. So I am proud to stand with all of you, with your incredible union. Oh my God, NYC, I don't think there's any union that packs more of a punch, pound for pound, that has been so impactful in pushing a progressive agenda. You are very, very lucky to be represented by this union. How about we give NYC a big round of applause, because you are incredible. So as chair of the City Council's Health Committee, I want you to know that I am putting everything I got behind you in this fight to make sure that hospitals do right by you, right by their patients, right by nurses, that we have safe, adequate staffing, that you have the space and the resources to do your job. No matter the threats from Washington, no matter the challenges, I am with you in this fight. Let's win this. Thank you very much.
Thank you, Mark. I just want to reiterate that, of course, we need to fight all these cuts in health care, but we all have to also live within our budgets. And when the budget is what it is, you have to make decisions. We all have families. Everybody here has a family and lives within a budget. When you have a budget, when your budget is limited, you don't go out and buy a new car. You don't put a down payment on a condominium. You don't go to the movies. You don't go to Broadway shows. You feed your family first. We are saying to the hospital, regardless of what happens, you need to feed your family, and your family is your patients, and your family are your caregivers. That has to be the priority of our hospitals, not exorbitant salaries like you see here. So we're not alone. We work for prestigious academic medical centers, and there are others in the city, as well as hospitals that are truly seriously underfunded and are safety net hospitals. But the issues that we face are the same. And I want to introduce Nancy Higgins, the chair of Maimonides Medical Center, to represent the People's Republic of Brooklyn, the third largest city in the world. And talk a little bit about the situations there, because while we took strike votes already, they're all on the verge of it over there. This is not going to be just restricted to these hospitals unless we do something about staffing. So I want you to welcome, with a warm round of applause, Nancy Higgins. Thank you.
Good morning. My name is Nancy Higgins, and I've been a nurse for close to 30 years, and I work in the surgical ICU for about 23 years. So today, we're here from Brooklyn. I want everybody to know we are in solidarity with our brothers and sisters from Manhattan and the Bronx, okay? And whose strike vote is an urgent call to stop the understaffing that threaten arms to all our patients, not only in the Bronx, not only in Manhattan, all over the state. In Brooklyn, we have more than 1 million Medicaid patients. They also deserve quality care like all New Yorkers. Yet, the threats to full and fair funding of safety net for hospitals target our patients in particular. So we have to remember our patients in Brooklyn, those that require primary care in the emergency room, because they don't have private doctors. They cannot afford it. And so our patients are in jeopardy. These cuts must be stopped. And I want everybody in here to think, as nurses, when you hear the buses are saying, oh, well, it's too expensive, we cannot afford it. As nurses, we are the frontline soldiers. We spend all our times, our minutes, every second at the bedside with our patients, so we know best. When was the last time your manager took an assignment? When was the last time your VP took an assignment? So when they sit there, they're telling everybody they know what's best. We know what's best for our patient. We know. So we need a fair contract. We need to be respected for our work, and every patient deserves safe, quality patient care. I want everybody to take a look here at the protest of assignment. It may not be the one from Maimonides. Does it look familiar to all of us? Take a look at the neonatal ICU. The hallway patients. Place is too hot. You have to walk around with a wet towel around you because it's so hot. You can't take care of your patient. Is this quality patient care?
No.
Is this what we deserve?
No.
So with that being said, in Brooklyn, we here and we right behind you. We are in solidarity and we have to do this. Safe staffing is what we want for our patient. Safe staffing saves lives. Thank you.
Thank you. And last but not least, we've heard from elected leaders, we've heard from the caregivers. Now we want to hear from the person that we picked out of the long line of community activists that wish to speak today, Anthony Feliciano, the Executive Director of the Commission for the Public Health Systems, a longtime advocate of safe care, quality care, equality in care, and the caregivers. I want you to welcome warmly Anthony Feliciano.
So when the nurses ask me to come, I do it very quickly. Why? Because I know you care about the communities. You stand for the communities. And just be very clear, there's a whole transformation that's supposed to be happening in healthcare right now. There's a Medicaid waiver that was supposed to transform healthcare to do better in terms of how the quality and the access to that care, to reduce emergency rooms, hospitalizations. But how are we going to do that if we don't have safe staffing? How are we going to do that if we do not clearly take care of the patients the way they deserve to be taken care of? That is critical. Give you an example here. There was an article a while back ago, the CEO of Presbyterian said about indigent care pool, which is the charity care for the uninsured, that we don't need to have all that money because we're making profit. But if you reverse the question, he asked them, are you willing to lower your compensation? Let me see how he'll answer that. Would he do that for the patients? Would he do that for the nurses? Would he do that for the frontline workers in that hospital? Ask him that question. This compensation has been a long time. It keeps growing and growing. And what we keep doing is having nurses not getting what they need, patients what they need. That's what's happening. This is run towards profits. We have to stop that. And this can get worse. A $5.5 million Medicaid cut. That means over $1 billion because of federal matching. We can lose. And you can hear and you can tell that these CEOs and the state will say, well, we can't do safe staffing. We cannot do these things because of these cuts. That cannot be the excuse. If we play in the hands of the Trump administration, we're no better than the Trump administration. And we have to fight that. We have to ensure on the budget cuts and so on. But we also have to make sure the quality and the care for our communities and patients are up to par. It's there. You do all this hard work. And communities feel it. Of the hundreds of community-based organizations that are part of our membership, they know I'm here because for all of them, because they also behind you. They're here to stand with you as well. And we'll stand all the way through. But we gotta fight. We gotta make sure. Not only just on the budget cuts, but moving forward, right? Because we have safety net facilities that are in crisis, are struggling. We have a tale of two cities, profitable hospitals and safety nets. and you know who serves the low-income communities. And we have to change that. And that's a long fight. But one of the things we can do when we want to transform, and we really mean transforming healthcare, it is to have safe staffing ratios. It is to ensure that the conditions that our communities go through that keep them sick reverse, that we fight for that. And that's only by fighting around funding and resources. And so I'm here to tell you that I'll stand with you, and I'll stand with you all the way from here to the picket line if need be. And we'll do this together. And so we have to ensure this because our communities need it. And this is not being selfish. This is a self-interest part of us because we want to take care of our communities. And I'll tell you, end with a story. My son was born 8 years ago in St. Luke's. I could imagine, I was there as my wife had 14 hours of labor, a little bit more than that. And the nurses had to rotate and leave for other patients. So I understand what you said before because I see it. But imagine if my wife was really in crisis. What would happen? This is about lives, the lives of all communities, all New Yorkers. And we have to make sure a cut is not always equal. Cuts that are coming from the state will impact certain safety nets more than others. It won't impact the profits ones. It's not as much because they don't take care of the communities that you have fought hard for, or they put them aside. But together, we need to ensure, again, the safe staffing around the budget cuts, to remove those, and we do that together. And so, once again, I stand here with you, and I'm very proud to be with you because you have shown me and my community-based organizations, that you stood with us when it came about patient care. Thank you.
Thank you, Anthony. We can have a few minutes for questions, and then I think some people are asking to do some interviews with us. So are there any questions? I know we've talked a lot. Okay. Some of us, I think, have to move to the back for some interviews. And again, I want to thank everybody who's come out today, our amazing nurses, our fabulous nurses who work every day caring for our patients, saving lives, doing the best that we possibly can with the few resources that we have. You're amazing. Our leaders are amazing. And give yourselves a round of applause for the work that you do every day. Thank you.